If a runner is dealing with a potential bone stress injury, they need an MRI. And today I want to share with you why. My name is Nathan Carlson. I'm a running specific physical therapist. Let's dive into today's video. When a runner begins to have a gradual onset of pain that isn't localized to a tendon and is worse with weight bearing, they get suspicious that they might be dealing with a stress reaction or stress fracture. The broad term for these injuries is a bone stress injury. The first step in this situation is often to get an x-ray, which is cheap and easily accessible. The problem is that they're really bad at detecting bone stress injuries. Around 10 to 25% of x-rays are going to show a bone stress injury, and often they're not going to find anything until the injury is pretty far progressed. So that's why we have to go into an MRI, because MRIs are really good at detecting these. And early diagnosis is really important because if we catch these early, we lessen the chances of worse outcomes. We reduce the risk of a non-union or a bone that's not going to heal without some kind of outside intervention. This is rare, but still happens in 5 to 9% of fractures. We reduce the risk of needing surgery, as shown by these studies on the femoral neck and on the navicular bone. And we reduce the risk of avascular necrosis, or bone death, where the bone actually dies. So an MRI is going to be our best bet because we're going to know if we're dealing with a bone stress injury or if we can continue to move forward with training. When we get that MRI, we're going to be able to figure out if we're dealing with a low risk or a high risk bone stress injury. High risk bone stress injuries include the navicular, the femoral neck, the fifth metatarsal, and the anterior tibial cortex. These locations either have poor blood supply or poor biomechanics, meaning that there's a higher risk of those complications that we talked about. Often, if runners develop a navicular bone stress injury or certain ones in the femoral neck, they're going to need surgery. So we need to catch those early to reduce the chances of that happening. Low risk injuries include the medial tibia, most of the metatarsals, and the fibula. These injuries have more favorable outcome. They tend to not need a surgical intervention and often do great with just conservative management. Getting an MRI tells us if we're dealing with a high risk or a low risk location. MRIs also help us estimate when you're going to be able to return to running. Bone stress injuries are graded from 1 to 4 based off of imaging findings. Grade 1 through 3 are stress reactions, meaning that there's a minimal, moderate, or a severe amount of swelling, with a grade 4 injury being a true stress fracture where there's a fracture line present on imaging. Stress reactions are dealing with swelling. Stress fractures are dealing with actual fracture lines. Often these two terms are used interchangeably. It's important to use the right terminology because stress reactions need a shorter rehab and stress fractures take a longer time. MRIs give us a game plan. With those high-risk locations, they often need to be pretty conservative too. It's very typical for someone to need to be 6 weeks non-weight bearing after the MRI to allow that injury to heal, while low-risk injuries can continue to do things that aren't symptomatic. So you're looking for 3 pieces of information from that MRI. You want to know the involved bone, you want to know the location within that bone, and you want to know the grade, because that helps us figure out the best plan and estimate a timeline for returning to running and eventually full participation. Higher graded injuries take longer, higher risk bones take longer, shown by these graphics from Nativ and colleagues. An MRI also tells us if we're dealing with a more spongy bone. Bones that are more central in the body, like the spine, the pelvis, and the proximal femur, are more spongy in nature. As we get out into our extremities, our bones are more cortical. Spongier bone is influenced to a greater degree by alterations in health status, specifically nutrition and hormone function. So that MRI will tell us what bone we're dealing with and if we need more testing or potentially a referral to a dietitian. MRIs help us establish a game plan. I see most patients in a direct access capacity, meaning I'm the first person that they're talking to about their injury. If I'm suspicious that someone is dealing with a bone stress injury, I'm going to refer them for imaging because I need to know what we're dealing with. Unfortunately, there are times where people literally cannot get imaging. Often this means the patient needs to go non-weight bearing for 6 weeks if we're dealing with a high-risk location, just to be conservative because we don't know what we're dealing with. MRIs give us a ton of information that is super helpful when rehabbing a bone stress injury. If your instinct is that is what you or your patients are dealing with, just get the picture. If you'd like to learn more about this, I have a free resource that you can find in the description.